Share on Pinterest. Autism spectrum disorder, ASD, is actually a group of neurodevelopmental conditions. It affects the way a person perceives and interacts with both other people and their surroundings. Signs and symptoms of ASD often present during the first few years of life. They can include things like problems interacting or communicating with others, as well as repetitive behaviors or routines. But what are some more specific signs and symptoms of ASD? And how is the condition diagnosed? Continue reading as we explore these topics and more. Importance of early diagnosis. Early identification and diagnosis of ASD is very important. When treatment is started early, it can make a big difference in a child's quality of life and ability to function. Children often show early signs of ASD between the ages of 12 and 18 months or even earlier. However, many children don't receive a diagnosis until after the age of 3. Trusted source. This is because sometimes the early signs of ASD can be difficult to spot. So, what signs can you look for? If you notice any of these behaviors, consult with your child's doctor as soon as possible. Early intervention and support for children with autism is very important. It can enhance a child's development and may significantly improve social skills. List of symptoms by category. The new edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which is published by the American Psychiatric Association, divides symptoms into 2 categories: trusted source, problems with social interactions, and communication behaviors that are repetitive or restricted. We'll explore both of these categories in more detail below. Let's start with social interaction and communication. Since these are 2 rather broad topics, they may be separated into subcategories. Trusted source, social skills. Some examples of problems with social skills include avoiding or having difficulty maintaining eye contact, not responding when their name is called, appearing to not hear you when you talk to them, preferring to play alone instead of with others, appearing not to share interests with others, avoiding physical contact, such as being held or cuddled, having a flat facial expression, having difficulty expressing their own feelings or understanding the feelings of others. Communication. Some examples of trouble with communication include delays or regression in speech and language development, reversing pronouns, such as saying you when they mean I, not using gestures like pointing or waving, difficulty understanding nonverbal cues, like gestures or facial expressions, talking in a flat or sing-song voice, experiencing trouble starting or maintaining a conversation, not following directions, repeating certain words or phrases over and over again, echolalia, experiencing trouble playing pretend note, understanding things like jokes, sarcasm, or figures of speech, restricted, unusual, or repetitive behaviors. Some behaviors to look for include things like repetitive movements, such as rocking back and forth and hand flapping, developing routines or rituals and becoming agitated if they're disrupted, becoming intensely fixated with an object or activity, like watching a ceiling fan spin, having very specific or obsessive interests, being extremely organized, such as lining up toys in a specific order, having intense interest in the details of a thing, such as the wheels on a toy car, rather than the whole object. Odd movement patterns, like walking on their toes, or exaggerated body language, being sensitive to sensory stimulation, such as lights, sounds, or sensations, shaping very specific aversions or preferences for foods, which can include specific food types, textures, or temperature. Other potential symptoms. There are also some additional signs and symptoms children with ASD may exhibit along with the above lists. These can include intense temper tantrums, large amounts of energy, or being very active, acting impulsively, irritability or aggression, engaging in behaviors that can cause self-harm, such as head-banging, problems with sleep, being more fearful or less fearful than would be expected when to see your doctor. Now that we've discussed the signs and symptoms of ASD in more detail, what are some indications that you should make an appointment with your child's pediatrician? While every child develops differently, some signs of ASD can appear early. If you have questions or concerns about your child's development, speak with your child's pediatrician as soon as possible. How is autism diagnosed in children? Before we summarize the diagnostic process for ASD, Let's first go over the diagnostic criteria. The DSM-5 defines two categories of symptoms: deficits in social interaction and communication. Restricted or repetitive behavior patterns. Symptoms are further broken into subcategories, 3 for social interaction and communication and 4 for behavioral patterns. A child must meet symptoms in all 3 social and communication subcategories and also in 2 of the 4 behavioral pattern subcategories to receive an ASD diagnosis. When symptoms are recorded, their severity must also be determined. This is done on a rating of 1 to 3, with 1 being the least severe and 3 being the most severe. Other criteria for symptoms include the following. Symptoms must be present from an early period of development. Symptoms must lead to a significant disruption in an individual's ability to function, such as socially or in their job. Symptoms can't be explained by another developmental or intellectual condition. Autism screening. Developmental screenings can help identify ASD early. During a developmental screening, your child's doctor will evaluate things like your child's behavior, movements, and speech to see if they meet typical milestones. While pediatricians check your child's development at every well-child visit, it's recommended trusted source that more focused screening for any developmental conditions be done during the following well-child visits: 9 months, 18 months, 24 or 30 months. Specific screening for ASD is recommended trusted source at well-child visits at 18 and 24 months. If screenings indicate that your child may have ASD, you'll likely be referred to a specialist who works with children with ASD for further evaluation. Tools for screening and diagnostics. While screening tools aren't a definitive diagnosis, they're useful for identifying children at risk for ASD so they can be referred to a specialist for further evaluation. Some screening tools that are specific for ASD are Modified Checklist for Autism in Toddlers, MCAT. This is a parent-completed questionnaire that's used for identifying children at risk for ASD. Screening Tool for Autism in Toddlers and Young Children, STAT. This tool comprises 12 activities that can evaluate things like communication and play. In addition to the diagnostic criteria provided in the DSM-5, other diagnostic tools practitioners may use to help diagnose ASD are Autism Diagnosis Interview, Revised, ADIAR. ADIAR can be used for individuals 18 months and older. It assesses communication, social skills, and repetitive behavior. Autism Diagnostic Observation Schedule, generic, ADOG. ADOG uses 30-minute modules to assess things like communication, social skills, and play. Childhood Autism Rating Scale, CARS. CARS can be used for children over 2 years old. The scale draws on 5 different systems for diagnosing ASD. Gilliam Autism Rating Scale, GARS-2. GARS-2 is a tool that helps parents, doctors, and teachers identify ASD in people between the ages of 3 and 22 years old. Is there treatment for autism? Although there's currently no cure for ASD, there are a variety of treatment options. The overall goal of treatment is to decrease ASD symptoms while increasing your child's quality of life and ability to function. Several different types of professionals may be involved in treatment, including doctors, psychiatrists, and speech-language pathologists. A treatment plan will focus on addressing your child's specific needs. What is the outlook for kids with autism? The outlook for children with ASD can vary greatly by individual. Some children may go on to live relatively independent lives. Others may require continued assistance throughout their lives. Early detection of ASD is very important. The earlier ASD is diagnosed, the sooner treatment can begin. This can be vital in making sure a child gets the treatment they need to improve their symptoms and quality of life. If your child has symptoms of ASD, make an appointment with their pediatrician. They'll help combine your experiences, their observations, and available screening tools to determine if your child needs additional evaluation by a specialist.